Okay, hello everybody. Welcome to Let's Talk Respiratory Therapy with Mike Long. He's our respiratory therapist, discipline head at UHN. I'm sorry about the noise in the background. That's my little guy. I'm going to try to keep him quiet. My name is Veronica, and I work for the University Health Network as a sourcing specialist for our People and Culture department. Just going to give you a quick little rundown of what UHN is prior to Mike starting. So Mike, next slide.
If I can do it. There we go.
Oh, awesome. So UHN is the largest hospital network in Canada. It consists of Toronto General, Toronto Western, Toronto Rehab, Princess Margaret, and the Michener Institute. So we are the first hospital to actually be affiliated with an education institute, which is wonderful because we get to shape the future of healthcare. We are a large organization. We have 16,000 employees, 3,100 volunteers, and over 8,000 students. We were voted the #1 research hospital in the top 40 list of Canada in 2021. And Newsweek declared us to Toronto General the best #4 in the world, which is really great. We have two foundations, one of which I'm sure you're very aware of, Princess Margaret. Yeah. I am still waiting to win a house there. And our two foundations have raised over $468 million to support our UHN in the past 5 years. And that's usually, they support through education, research, buying equipment, etc. Next slide, Mike. I'm usually the one who has to tell the person to, flip the slide. So it's kind of cool that you're doing it for me. I'm going to mute whoever is being a little bit noisy. Okay. So the perks of UHN. We are downtown, which is awesome because we're in the heart of the Discovery District. We have some really great leadership programs. So if you're looking to build your career, UHN is definitely big enough that you'll be able to do it. I've been here 11 years now, and part of the reason I have stuck around so long is because I've been able to work at 4 different sites in different roles. So you could definitely don't have to go too far from home to explore and grow in your career. We have this great thing called the I Give at UHN 50-50 lottery raffle. So one lucky UHNer gets to take home, I believe it's almost $26,000 now every month. And I'm still waiting to win that. We have some great staff appreciation events. Pre-COVID, we did some great barbecue lunches, and during COVID, we had some ice cream carts visit the unit. The foundation is really great at helping us throughout the year. Sometimes we get meal vouchers, sometimes we get parking. It depends. Through the pandemic, they were really great at getting us some perks. Another perk of having a school associated with us is that we do get 25% off any course at Michener, and 10% off at any UHN gift shop and UHN pharmacy. Just show your badge. We do have added value benefits, which are some really cool benefits and discounts that you can get through online coupon codes usually, and anywhere from Cineplex to Canada's Wonderland to tickets to the Raptors. All because we are such a big organization, and organizations do work with us to offer us a discount. We have a great total compensation wage and benefit package, and we have plenty of committees that you can join. We do think this is a great perk because your life is not just your work, it's also your activities and your hobbies. And we have plenty of different committees that you can join in your own time to extend those. Next slide, Mike. So when I was talking about our total compensation package, this is just a really quick overview of the quality of work life at UHN. We do have, insurance plans and paid and unpaid leaves. We have flexible work arrangements, especially with COVID. Maybe not so much for your respiratory therapists, but I've been lucky enough to be able to work from home a little bit. We have a great retirement pension plan, HOOP, which is something that you can actually carry with you from hospital to hospital in Ontario. So if you ever do choose to leave UHN, you would be able to take that with you. We try our best with recognition and work-life harmony. We have plenty of opportunities for development. Mike will share some of the stuff that he's been through and has done. And we really care about your well-being and mental health because that's been a really big thing with COVID. And so we have our employee and family assistance program. And we got a little bit of a benefit bump when it came to mental health during the pandemic, which was wonderful and well received. And we try to keep everybody in the loop through communication. Our CEO is really great about sending out a message every week, telling us what's going on in the hospital, what's up. And we have open forums where we can ask questions and keep in the loop. So that's just a little very quick rundown of UHN and its benefits and why it's a wonderful place to work. But now I'm going to hand it over to the person you're actually here to listen to, Mike, and he's going to take you through some of the slides on respiratory therapy. Take it away, Mike.
Thanks, Veronica. And two really quick points on what Veronica just said was recently there was an RT that won the 50-50 raffle. So real people win it, and it could be you too. And about the hoop benefits, I know that, you know, when you're starting your career, it's not something you really think about, but it's not even something I've really thought about too strongly yet. But I do know that my financial guy did a double take when he saw it. So it's definitely one of the better pension plans available. There you go. So sort of real quickly, an overview of the RT coverage areas at UHN. Pretty similar to any hospital you can think of, but specifically at UHN, we do cover any of the outpatient clinics for some of the diagnostic testing. We're in the operating room more so, definitely at Monday to Friday at Toronto Western, and evenings and weekends at Toronto General. There's a bit of mix of models because the anesthesia assistant modeling is a little bit different between the sites. We cover the emergency department, obviously, and all the inpatient units, step downs, and of course the intensive care units. We have four main intensive care units at UHN. We also have a cardiac cath lab, a hyperbaric chamber, and some rehab sites as well where RTs are involved. So of course we manage the ABCs, primarily the A's and B's and mechanical ventilation, but we're also involved in research. So as we're one of the top research hospitals, there's a lot of ICU and ventilation research that goes on. A number of therapeutic diagnostic interventions. Obviously, we educate patients, family, and staff, and we transport intubated and critically ill patients, both internally across sites and externally, sometimes repatriating as far as Thunder Bay. And of course, we're a part of the Code Blue team, the outreach or response teams, or some places call them access teams or MET teams. And we, at the Toronto Western Hospital, we have an arterial blood gas lab for the whole hospital, as well as just for the ICU. And at Toronto General, we have a point of care system. So onboarding and mentorship, a lot of times people are looking, the questions I get for prospective staff is, you know, what does the onboarding process look like? How supported are you? So I would say as a new grad, when I started at UHN, I felt very well supported, and we offer no less than what I experienced when I was a new grad. So we have a very strong mentorship culture. We have a very robust orientation checklist, a lot of policies and guidelines to refer to. You're never required to remember everything, maybe a few things, but not everything, at least know where to find them. You have lots of buddied shifts, 2 to 3 per area. So orientation can sometimes take, for our internal students, a few weeks, like 2-3 weeks, and an external candidate might take upwards of 6 weeks, but there's no end date, and learning is a process. So it takes as long as it takes. We have dedicated mentors. So those are experienced RTs that are willing to be your point of contact if you have a connection with them and you want to reach out to them and ask questions. Not that everybody's not available for questions, because we have that strong culture and a strong team dynamic. So briefly, a little about me. The only way I could really showcase UHN was what I've gotten out of it and what UHN's provided me in in my tenure. So I was a graduating class of 2006, was a Michener student, and I was a UHN based student. So I did my training at UHN, and I've worked at UHN my entire career. Throughout that time, I've had an opportunity to be a champion of several multi-center studies, which I'll highlight a few, all the way up to gaining some expertise and becoming a co-author on various publications on respiratory effort and mechanical ventilation. I joined this hyperbaric team in 2018 and became certified as a CHT in 2019. Most recently, I'll be taking on the clinical RT CHT lead role in that area as well. So leadership roles, again, with all of the leadership development within UHN, it's allowed me to take opportunities of being the professional council co-chair, which then I became the professional practice leader on an interim basis. And then after some redefining of some roles, I became the discipline head, which is a 3-year term position that I'm currently in my last year. And then I'll be becoming the charge therapist at Toronto General later this year. Also throughout, if anybody likes travel, a lot of this stuff leads to some presentation at conferences and workshops, and then you get reimbursed for not only from the CSRT or whatnot for your travel expenses for speaking, but also you get paid education days, so it makes it worthwhile. As mentioned, Michener Institute's part of UHN, and we actually even take up to a third of the entire clinical placement. So we have a huge stake in shaping the future of the profession. We also, prior to COVID, we had a 2-to-1 preceptor model where we would actually have 2 students on site at the same time assigned to 1 preceptor. And there's a lot of benefits associated with that. And we actually even turned that into a research project. Now through COVID, with the higher need of PPE coaching and added levels of safety, we did kind of modify that 2-to-1 model. So it was maybe 1.5 to 1. It was sort of like a 1-to-1 as far as pairing, but there was 2 students on site. So you still got that they still got that opportunity for peer-to-peer support, which is one of the benefits of this model. But looking forward to, as with everything, getting back to normal. So also with being paired with Michener, or Michener being part of UHN, we've had teaching opportunities. A lot of the RTs, or some of the RTs, teach at Michener for the critical care nursing course. They do the hands-on ventilator workshops on a contract basis. So that's additional hours and fees for service, just for being the experts at UHN. And you also get status appointment, which allows you status appointment because you take students. So working at UHN being an expectation that as a teaching hospital, you take students, you then get to have the status appointment at the Michener as a preceptor, which allows you free access to the preceptor workshop and discount rates throughout the continuing education catalog. So some of the showcases of RTs involved in research at UHN is, as I said, this research article about the peer learning approach. There's all the RTs on this list are UHN RTs. As on this paper, this is the original study involving isoflurane in use in the ICU using the Anaconda device, and this was done. This was published November 2020, but the actual study was done years ago, which actually really helped us along for when we started using it in COVID patients this year, or this last 2 years. This one was, I had the fortunate opportunity to be part of this study with involving developing a non-invasive method of detecting respiratory effort in ventilated patients. And at the beginning of the pandemic, this was UHN's ingenuity at its finest, where we solved the issue of potentially having to ventilate multiple patients on a single ventilator. So, and to do it safely and to be able to independently manage the patients. Luckily we never did, and hopefully never will get this far, but it was nice to know that we had it in our toolbox. And another one, COVID related, actually using inhaled gases to treat COVID. To be surprised that nitric oxide has antimicrobial, antiviral effects. So even looking at treating disease. And of course, there's been a number throughout the years of other ICU related studies. And then there's many more that's ongoing right now. There's comparing spontaneous modes and promizing. There's the Save ICU, which is the anaconda sedation delivery, looking more at respiratory effort in severe ARDS. There's lung mechanics studies like caviards and helmet BiPAP. So on the road to get there, a lot of the support is actually financial and time. So you do get up to 5 paid education days to support professional development. There's also opportunities like the CAP Fellowship, which is CAP stands for Collaborative Academic Practice, and that's it's an area at UHN that offers this fellowship where you actually get 2 protected days a week plus education to develop and conduct your own quality improvement project. So you got ideas to improve things at UHN in evidence-based practice, then it actually gives you protected time to do it. The leadership courses like Lead Up, Emerging Leaders, these are also fully protected time courses where you get a lot of workshops and opportunities to develop those leadership skills. And there's a number of individual workshops offered by People and Culture, formerly known as Human Resource. A lot of value in those courses as well. And as a plug, we also have our in-house accredited introductory hyperbaric medicine course, which is one of the prerequisites for challenging the CHT exam. I think I mentioned this also, is becoming the expert also gives you the travel opportunities. So if that's your impetus for doing these things, it's good enough, right? It also gives you a chance to meet the other leaders and experts in your field, learn from others as well, and there's a variety across Canada and even in the United States. So our intensive care units at Toronto General, we have the Medsurg ICU, which is an ARDS referral center. We recently received the ELSO Award for Excellence in Life Support Platinum level. We're one of only 24 centers in the world to achieve that distinction, and that really speaks to especially ECMO. It takes a whole team of all the professions to make sure that you care for these patients properly. We have the solid organ transplant, primarily in our where we primarily have to deal with them are the lung transplant and liver transplants, and a lot of the multi-organ transplant patients. And we have a lot of specialty post-surgical care, like the pulmonary thromboendarterectomies for chronic thromboembolic pulmonary hypertension, which is basically chronic blood clots in the pulmonary arteries, and the surgeons remove them and the endothelium. But there's a lot of cardiorespiratory nuances to their post-care. We have the large cardiovascular ICU, the Peterborough Cardiac Center, world-renowned cardiovascular surgeons. That's where the heart transplants go. And we have Cardiac ICU, which is also tied to the cardiac cath lab. At the Toronto Western Hospital, we have premier medical neurosurgical ICU. So there's a lot of brain injury and stroke there, spinal cord injury, and post-neurosurgical care as well. And they also have the neurointerventional for blocking the arteries. So to help break it up so that I'm not just talking at you, here's a quick little video of, this was made a number of years ago. So they talk about the ICU size, it's much bigger now. We've expanded quite a bit. But the sense of camaraderie and family that this video portrays, I think is really spot on. And that does speak to what it's like in the ICUs at UHN.
The Medical Surgical Intensive Care Unit, or MSICU, at Toronto General Hospital is a 23-bed Level 3 critical care unit. Each year, more than 850 patients with a wide array of medical and surgical problems are admitted to this unit. A highly skilled interprofessional team provides leading-edge care to these patients, some of whom are the sickest patients in Canada. Our team is dedicated to providing compassionate, patient-centered care that respects the values and needs of both our patients and their families at a time when they are the most vulnerable.
Medsurg ICU is an extraordinary place to work, on a huge part due to the people that work here. When you watch your colleagues work, you can see the dedication that they put behind their actions in helping the patients and helping the families.
One of the things that we're really proud of is that we have the patient at the center of everything that we do. We try to get to know our patients. If we just deal with the patient as a patient rather than as a person, we'll just be treating their numbers.
I started off on the multi-organ transplant unit, and I just chose to come here because I still wanted to work with transplant patients, but I wanted to do things with other patients that were more complex and that were innovative and new.
I was in a medium-sized hospital, and they did have an ICU as well too, but I felt like if I was going to invest the time and effort, I wanted to go someplace where I'd be challenged.
The ICU makes really extraordinary things possible. It gives people some time to get better, or for us to figure out some new way to try to help them. I think it's the time that it gives us that it helps us build bonds with them, and you know, technology changes the way we do things, but it doesn't really take away from how we care for the patient.
TGH gives us these tools that helps us provide patient-centered care, and it is that care that provides the hope for patients. That's what gives me a huge gratification in terms of care for my patients.
We're always the ones at the bedside. We're the first point of contact with the patient and their loved ones in order to help the patient recover and the families get through this traumatic experience. We can provide emotional support.
One thing about the staff is teamwork, and that's one thing we strive for. They come together in a crisis. They do things to help each other, and that's one of the things that makes it really easy to work here because of the people.
I think because we're a family. No matter what happens, you're all together still in one big group. And I think my colleagues, whether you're having a rough day at work, whether you're having a great day at work, they're there to support you much as a family is.
The technology has changed over the years, there's no question. We've seen big advances in the technology, but the nursing care here has not changed. It's always been exemplary. I could work in any ICU, but I wouldn't work anywhere else.
MSICU is extraordinary because of the people. You're only as good as the team you're working with. When I'm nursing a patient, I'm not only taking care of this patient, there's ownerships from all the disciplines, whether it be respiratory therapy, physiotherapy, physicians, pharmacists, dietitians. We all have our roles and we all contribute and we all collaborate for the best outcomes.
When patients start doing well and start recovering, you feel that all your work that you've done with them to help them to get to that point, there's gratefulness there on your part that it's actually worked and that they will be walking out of the unit.
I like the patient. Around this time last year I was in a coma.
Yeah, that's fabulous.
10 months later, I'm mobile again.
Why do I continue to work here? We have the best interprofessional team probably anywhere in the country looking after our critically ill patients. We have fantastic nurses, great respiratory therapists, outstanding pharmacists, terrific physiotherapists, amazing patient care assistants. I can go on and on and on and name all the people that help with the management of our patients, but together as a team, we work in an amazing model of interprofessional teamwork, and it's obviously the patient who benefits from that.
So that's just a brief look at what kind of an everyday is. When COVID's over, one of those things to get back to normal is having the patients come back and visit us, and they often come back and give thanks. And so that's something that we've missed in the last couple of years, but definitely love it.
I'm so glad we could all take this trip together, son.
Yeah, and Kayak made getting here so easy.
Here we go.
That's not my video. So another thing that is a huge benefit of UHN. We're a pretty big hospital, and so it's really nice to have, as an RT, it's really nice to have a complete toolkit at your fingertips. So no matter, like, we have 6 different kinds of ventilators, so you never really get uncomfortable with new types, because a new type comes along and you've been used to 6 different types anyway, and it allows you to stay adaptable to anything that comes out, as well as each ventilator that has their own special modes or their own special something associated with it. You can switch out the ventilator and you can put it on the patient. So we still use the oscillator. We have our ECLS ECMO protocols. We've got a lot of RT-driven ventilator protocols where we just have our physiological parameters, and those are our limits, and we play within it. And so we have a lot of autonomy and a lot of tools that are in our belt. So we all, standard, we manage the airways, we perform, we assist, we maintain the intubation, the tracheostomy changes. We have inhaled medications, obviously bronchodilators, but also pulmonary vasodilators, both nebulized and nitric, anesthetic agents in isoflurane, and of course antibiotics. A lot of diagnostic and therapeutic interventions like MIEs and cough assist and lung volume augmentations, bronchs, perks, and as well as not just our evidence-based clinical protocols, but even the research protocols. So a lot of learning comes out of those, where different respiratory mechanics or alternative respiratory mechanics that are also still clinically standard of care. So it allows you to expand your knowledge and your tool belt. And we also cover the step-down units. That's primarily where we have our BiPAP patients and our high oxygen patients that aren't requiring ICU. And we cover obviously the rest of the hospital, including the emerge. As I said, we manage the trach patients. We have a really robust list of medical directives that, again, allows us to have a lot of autonomy with our care. From oxygen therapy to ABG, all the way up to heart-line insertions and IVs. And we have our bronchodilators as well. I mentioned this already. So the Toronto General has a POCT program where we have point of care blood gas machines, and the Western has fully functioning ABG lab. We do patient family education, clinic referrals, DNX ablation cough assist, and then bronch and bedside spirometry for outpatients. And I mentioned the coverage for the OR. Primarily it's AAs, but we do Monday to Friday at the Western and the off hours where they're doing more scheduled care on the nights and weekends. And a lot to help manage with the emergency and difficult airways and adjuncts. Princess Margaret Hospital, we also have a very specialized cancer care population. So it's a lot of general wards-based care, but a lot of nuance related to that. A lot of the radiation injury offers a lot of anatomical difficulties with trachs on top of oxygen therapy concerns. And there's a outpatient and inpatient bronchoscopy suite there. There's some OR involvement, and often they do mock pediatric codes, which is a bit unique for UHN, because as a cancer center, that's the more likely center to experience codes with children. So Sick Kids Hospital being across the street, there's sort of a joint mock code involving kids on a regular basis. So that's always good to increase your skills there, because we don't generally have children at UHN. And as I mentioned, variety of outpatient clinics. I mentioned the hyperbaric unit. We also have the TB clinic at the Western, the Bronx Suite at both the Western and PMH. There's been virtual care ongoing at both Toronto Western and the rehab and the Asthma and Airway Center. We have an asthma and airway RT there. So the hyperbaric medicine unit, just a quick showcase here because it's pretty unique. It's still the largest in probably Canada, if not Ontario. And we have 3 single occupancy chambers, as well as a large, that box that looks like a room there. Whoops. That box that looks like a room there is actually a big chamber where we can have up to 2 intubated and ventilated patients at one time. And we go in there with them. And I think it's really fun and exciting, because that's where we really get to expand our scope, because as RTs, we're the only people inside. And although there's an anesthetist outside, it could take them upwards of 6, 7 to 10 minutes to get inside under pressure. So you're there managing every aspect of care in this unit. And then UHN RTs are everywhere. We've, from taking such a large part of the clinical class to just having a lot of the RTs work at UHN and move on. We've seeded a lot of positions throughout the GTA and beyond, and then even upwards within UHN. There's charge therapists, there's discipline heads, some have gone on to become patient care coordinators, clinical managers of other areas, managers of practice, and directors. We have currently a dedicated research RT at Toronto General, and we had one for a short term at Toronto Western as well. And then, of course, many go on to become anesthesia assistants or perfusionists. And I just want to leave you, so it's not too dry, just a little bit of fun that we're pretty serious about our jobs, but we also have a lot of fun too. Assuming
You may have to copy the link into Chrome.
interesting. No, I can't.
It's not letting you?
No.
I can try and bring it up. I just don't know that it'll share on my screen.
There we go. Copy hyperlink. Chrome makes my computer go funny.
Yeah, it does this to me too with the new upgrade on our computers.
Well, you can trust me that we're fun. Yeah, okay.
Give Mama kisses.
I can try and bring it up, Mike.
Yeah. I don't even know why my copy and paste isn't working. Oh, there we go.
Success.
You're asking how to have a safe surgery. I'll tell you it's not a secret or a mystery. For an OR game that's strong, where nothing should go wrong. Keep following along, now with me, well we. And be sure to check the name for surgery. Surgery, singing I love protocol. Get scrubbed up cause this ain't no Reiki. I love protocol. Say your name and what your role will be. We're all geared up in scrubs and looking fine. Our tools are sanitized, they're all in line. Prophylaxis, VTE, hepatitis and TB are the things we check to see. Yeah, we check to see. Before long we're moving on to surgery. Surgery, singing I love protocol. Room so clean it's your lawyer's dream. Yeah, I love protocol. Grab those labs and check with me. Soon we'll all go home and we'll leave him alone. Before moving on, consent to me. Know me. Then we'll be moving on. Our game is strong and error-free. Singing I love protocol. Anesthesia's gonna be a breeze. Yeah, I love protocol. see now. I love protocol. We won't close up till we're all thumbs up now. I love protocol. Was it safe and sound or do we? I love protocol. Check to see no sponges, AWOL. I love protocol. No blood lost in needles. I love protocol. Did the gear tube it or was it separate? I love protocol. Were the airways clear with I love protocol? Can you check where the post-op will be? I love protocol. Only one chance at surgery.
That's a great song to do it to. Gets everybody pumped.
I've lost you all though.
Yeah.
Oh, I guess there we go.
Awesome. Thank you so much, Mike. We are going to open up the floor to any questions. If you guys have any burning questions, feel free to unmute yourself or to type them in the chat. I do have 2 questions that I received last time we did this, Mike, but I didn't get to send to you, so maybe we can just answer them now. What is the best advice you can offer a new RT grad?
I always think, maybe you've heard this one before, but I mean, it still holds true. Your first year of RT as a new grad is really your 4th year of respiratory school. So it's really just, putting yourself out there, applying, still asking questions, like never stop asking questions because it's the quiet ones you worry about. But yeah, it's just getting as much experience as possible and applying yourself. And then really that carries on, year after year after year.
And the other question I had is, what do you consider the most difficult thing about your job?
Probably, we deal with end of life, and we deal with that pretty regular basis. And for the patients themselves, it can start to become not business as usual, but you can start to get used to it. But it's the families, I think, is a big thing. And so I think definitely through the years of COVID, with less families physically present, maybe it's been taxing on people that obviously it's obviously taxing on people anyway, but I think just to be prepared that it is a bit more different when everybody's physically present. There's rooms full of people, so that can be hard.
Yeah, I can definitely imagine. We do have a question in the chat. I think it was mentioned earlier that the majority of hires from UHN come from Michener. How would you suggest making a resume stand out? None of us are from Michener.
Well, the majority of our students are from Michener, and it is true, if you do like to, if you have good students, we like to keep them because we've spent the time training them as students, and they're used to UHN, but it's not 100%. So, and I can say even just recently we've hired at least 1 or 2 from external to Michener. So just really stand out clinically in your own, either in your own student precepted year or even wherever you're working, to have good strong references, and then really stick out in the interview, and then all of the usual, something that makes you stick out on your resume rules apply, right? Like no, I wouldn't say spend the money on the hyperbaric course, but I know that if you were interested in Toronto General, at least knowing a little bit about hyperbarics and things like that, or researching the hospital that you want to go to and find out what those niche things are to show that you've done something.
Okay, awesome. Does anyone else have any, oh, thank you, Lisa. Does anyone have any other questions for Mike?
No.
Oh, my son said no. He's trying to give you your time back.
No, Mom.
Okay, well, Thank you, Mike, for being here. I know that the session is being recorded and I'm going to provide it to Vanessa, and Vanessa is going to be sending it out to the students. Thank you very much for being here. If you guys have any questions or are interested in anything else, you can always email me through Vanessa or Mike. I'm sure we'll be happy to answer any questions. And thank you for being here with us today. All right, Mike, you get 10 free minutes back.
Thank you all.
Have a wonderful day, everybody. Bye.